There are many reasons why children need to get back to school, not least of all completing the curriculum. In some cases, being in school means the only meal of the day for some people on the nutrition program. But parents and teachers continue to be worried about whether the rules on COVID-19 will be enough. For more on this, joined now by the Bhekisisa Centre for Health journalist Aisha Abdool Karim. Aisha, hi, good evening to you. There's been so much talk about this here and in other countries. With schools opening really towards the end of the month, what do we know about the risk of spreading the virus in schools from what we've already seen?
Yeah, so, I think it's important to kind of look at things in the broader context of what we've seen in South Africa. So, as we know, schools were closed earlier this year when we were during a hard lockdown, and we started to see learners returning in around June. And during that time, we did start to see outbreaks in schools. So we did have a situation where we saw teachers getting infected. But we also need to keep in mind that this was during a time when nationally we were seeing a huge spike in cases, particularly in Gauteng. We saw that the number of cases was rising and the risk of getting infected was very high. So even though there were outbreaks at schools when they started to reopen, it was during a time when your risk of getting infected was very high overall. There was actually an analysis done of 700 schools in Gauteng, which found that teachers were not at higher risk of getting infected with COVID-19 than, similar demographics within the population. So I think if you look at it that way, we can say that teachers got infected, but not necessarily from being at school. What we do know internationally as well from the research coming out of other countries is that the risk for children is extremely low. They are one of the lowest risk groups when it comes to getting infected with COVID-19. And people under the age of 18 are somewhere between a third and half as likely to get infected than adults over the age of 18. There's also a lot of evidence to suggest that young children, and particularly I'm talking about children in elementary school, pose a much smaller threat when it comes to transmission than perhaps older children who are in high school. And then largely I just think it's important as well when you're talking about contextualizing things that the benefits of having schools open outweighs that very small risk that there is. As you mentioned, schools play a very vital role to several aspects when it comes to like nutrition or, you don't want to disrupt education. And we're at a stage in South Africa's COVID-19 response where we are trying to reopen the economy. We have people returning to work. And so we don't want to find ourselves in a situation where parents have to go to work and then children are left without somewhere to go because the schools are closed. Because what will happen to those children where there's no one left at home to look after them? So it's really important to look at these things in context where we know there's a very low risk of transmission within schools. We know that children are at low risk. And we can see that there are huge benefits to having children at school as opposed to the risk of possibly getting infected.
And then in the middle of that, there's the school nutrition program. It's 9 million children, 11 million by some estimates, who actually receive a meal at school every day.
Yes, so we know that the national nutrition program is responsible for providing a meal to 9 million children every single day. And so when it comes to the importance of that, that's also really important to factor in. There were several surveys done that showed that during lockdown, when that feeding program was not active, I think it was that the number of children who were hungry, the levels of child hunger doubled during that period. So it's really important that that program be active, which is luckily something that has been reinstated now. Even though the schools are closed for the next 4 weeks, that program is still in effect. And I think, UNICEF recently released a report about a week ago, which said that an additional 6.7 million children under the age of 5 would suffer from severe malnutrition in the form of wasting. And 80% of those children would be from sub-Saharan Africa and South Asia. And we've seen that locally, even during the lockdown. We saw that child hunger was increasing. We saw the impact of not having this feeding program in terms of child nutrition. So it's really vital that even if we are going to have schools closed during these 4 weeks, that the feeding program remains active. And that we address this issue, because child nutrition is so severe. And I think this is something we've seen when it comes to other causes as well in South Africa, where we cannot divert resources away. In focusing our response on COVID, we can't neglect other problems and other diseases and other health concerns in favor of just fighting COVID-19, because we know that the long-term impact will be there will be long-term consequences past that.